I'm Craig Buckman, the department chair here for otolaryngology at Washington University in St. Louis. So thanks for taking the time to be with us tonight. We're going to focus a bit on our T32 research program. So each person as they jump on will introduce who they are, and then we also actually have some alumni here with us as well that have gone through the T32. And some that are actually in the T32 and those that support the T32. So you'll hear a bit from each of them. But first of all, I wanted to just give you, background on WashU in general, our program, and then just a couple of minutes, and then I'll turn it over to Dr. Liu after that. So let me just share my screen here. This is can you all see that? I hope so.
Yes.
Yeah, good, thanks. Yeah, so this is actually our campus basically from looking from the west towards the east. So the arch is down this way. And then this is the Barnes Jewish Hospital, Children's Hospital, and then WashU campus is in here as well. So this is sort of our whole campus for those of you who don't know about it. Our program is an old one. It's it has long storied history. Dating back into the 1800s, so it's one that's been around for a long time. Probably the second oldest program behind Mass Ioneer, certainly right neck and neck with, I think, Penn. So you can see we go back into the 1800s, and our history is very much sort of the history of otolaryngology in a lot of ways. Many sort of famous people. Theo Walsh was a famous ear surgeon, and then Joe Gura was one of the fathers of head and neck surgery, one of the two people in the United States that really sort of wrestled head and neck surgery away from the general surgeons together with John Conley. And so in many ways, I think head and neck surgery started here. And then John Fredrickson was a sort of a generalist, but did a fair amount of ear research. Rick Cole, whom some of you might know, is a very established cholesteatoma researcher and really a wonderful person. So, currently we rank fourth in NIH funding according to the Blue Ridge, which we're really proud of. And our residency is highly rated for, in general as well as for research. And we do pretty well in the U.S. News. And so currently we're 50 faculty. 32 of our faculty are deemed clinical plus or minus research, and then we have 18 faculty that are research alone, which totals us out to 50. And you can see that we're very balanced across all the specialties, and that as well as across investigators. So as you start to think about our research programs, and you'll hear a lot more about it, we have a nice balance of basic science, sort of translational and clinical science across both ear and hearing, as well as tumor biology and laryngology and voice, as well as an outcomes unit, which is really a second to none. And Dr. Piccirillo will talk to you about that. So, what are we known for? If you think about us historically, we go back, as I said, into the really early 1900s, where the Central Institute for the Deaf and even the laryngoscope was founded here. As I said, Dr. Ogura was really, a big point in our program in getting head and neck surgery started here. But, even to this day, our head and neck program is really ultra strong, and we're very proud of that. And you'll hear more about the research going on in that, hopefully. Our implant program was one of the first in the U.S., and we currently do over 250 cochlear implants a year and do quite a bit of research around that. Dr. Piccirillo's work in comorbidities is really, fantastic as you think about the various disease processes and how they affect outcome and function. And then again, you'll hear about our research programs. But I would say sort of far and away what we're best known for, frankly, is training the next generation, which is you guys, and training leaders in the field, both clinically as well as from a research perspective. And that's really sort of fundamental and foundational to our program. And the T32 is really one of the best mechanisms for that. I always put this up just to say, you know, what makes a great residency program. And these are things that you should be assessing as you start to look at all the different residency programs. Most importantly is a really strong clinical opportunity that has both breadth and depth, meaning that all the different specialties are really, you know, well represented with lots of case opportunities, as well as a wide variety of staff, attending staff that can help you. And then, of course, the case numbers to go with it, and graduated responsibility. And so, you should ask our graduates. I think they can tell you better, but I think we have that in a really strong way. Our hospital is a great place, about a 1,300 bed hospital. Our culture is a nice place to work and live. I think you'll find as you talk to them that this is not one of those sort of edgy programs. Rather, it's a really nice place to work, and most people are smiling and happy and have a good day in their work and life. So there's a good opportunity for mentorship because of the breadth of the faculty that we have. And St. Louis, I'm sure all of us will tell you, is a great place to live, despite what you might see in the news. It actually is really quite a nice place. This is a map that shows where our alumni end up, and you'll hear from some on the West Coast tonight, as well as from the East Coast. And so there's a wide breadth and depth, and you can see that most states we have pretty good representation, although it looks like North and South Dakota we haven't done too well, but there's not a lot of otolaryngologists up there. So, but you can see that we really have a broad representation. And I'm just going to finish up. This is sort of the main building where our main clinical operation is. This is called the Center for Advanced Medicine. We call it the CAM. We're up here on the 11th floor. There's a new hospital in West County called Barnes West, which is also a beautiful facility. I know our residents or resident graduates that are on have probably not seen this before. So this is a new hospital that's up and running. And then this is our dissection lab, which is really a fantastic facility that gives a lot of opportunity to do a variety of different simulations. So, you know, with that being said, I will wrap up my comments. I just want to encourage you to, especially with regards to the T32, to reach out and ask questions. It's a wonderful dynamic program. It's absolutely a perfect stepping stone to sort of launch into an academic career. And we're really super proud of it. So thanks for taking the time to be here tonight. And I hope we put our best foot forward. So thanks. I'll turn it over to Dr. Liu to talk next. She's our program director.
Hello, everyone. It's a pleasure to have you tonight. And again, I'm Judith Liu. I am the program director. And I'm actually a proud alum of the T32 program from back in the 1990s. So let's see if this works here. Okay, so can you see some slides?
Yeah.
Okay, awesome. So again, this is a very brief overview. Dr. Buckman has done a wonderful job of giving an overview of our department and the history. So our consortium consists of the Washington University, Barnes Jewish Hospital, St. Louis Children's Hospital, and the VA hospitals. We have 5 residents per year, of which 3 are clinical and do a 5-year residency, and 2 per year go into the T32 program for an extra 2 years of research. And the main training locations are the Barnes Jewish Hospital, Children's Hospital, and the John Hopkins VA Hospital. As Dr. Buckman mentioned, we have quite a few satellite sites, including one that should be coming on board shortly. So we have the Barnes West County Hospital, the Missouri Baptist, South County Center for Advanced Medicine, the Children's Specialty Care Clinic, Christian Northeast Hospital, and St. Luke's Hospital. So our residents do have the opportunity to see multiple venues as well. So where do our residents come from? This shows you where the states where the residents consider home. And interestingly, we have the greatest number from California, but they're really from all over the country. Similarly, they went to med school across the US, but we are more concentrated in the Midwest and the South. a few from the West Coast, and a few from kind of the Northeast. We also have one resident who graduated from Costa Rica, as well as another one from India. So the aspects of WashU residency is that we're located in the Washington University Medical Center. So that is a level 1 trauma center for both adults and children. And we have a 200-mile referral radius. And what is wonderful about the medical center is because it's a world-class medical center, we have colleagues in training programs and departments across the medical center who are highly ranked and well regarded in their specialties. And so we have the opportunity to learn and collaborate in patient care with them. As Dr. Buckman mentioned, we have a long history of leading in head and neck cancer surgery, excellence in clinical and research training. Our residents have not had difficulty with obtaining fellowships, as well as gaining training and mentorship for academic practice. So this is just a slide to give you some more information. There's lots of residency information on our website. The previous videotape residency Zoom presentations are on YouTube, and they can be accessed through the Taste of WashU ENT website if you're interested. For all of the medical students who may not be aware, there is a program that's new this year called Preference Signaling, and you should sign up for it. I highly recommend it. It's a way for you to tell up to 5 programs that you are interested in them, so that you can help distinguish yourself a little bit from the many other hundreds of applicants that are out there that are applying to the same program. So this is a way for you to tell us as program directors and faculty that for any reason that you choose, that you are especially interested in us. For our program, the deadline for applications is October 16th. And if you're interested, the interview offer should be going out sometime in mid-November. So do not be looking for it before November 9th. All of the otolaryngology programs should be waiting to offer you interviews until after that. So please don't hesitate to reach out if you have any more questions, and we look forward to seeing your applications.
Great, Dr. Liu, thank you so much. And my name is Dr. Jay Piccirillo. I'm the director of the T32 program, and I appreciate Dr. Buckman's introduction and again, Dr. Liu's description of the overall program. I'd like to give us just a few slides introduction about the physician scientist training program, and then allow our faculty who are present, the alum, and then some of our current trainees. So briefly go through the slides here. The program faculty consists of at least 21 individual scientists, and as you can see here, these individual scientists cover the main areas of the NIDCD: hearing, balance, speech language, taste, and smell. And our faculty cover the range from basic biomedical science through translational, clinical, and behavioral health sciences. And while you don't necessarily need to study this table right now, it is available through our material and on the website. So we have an impressive list of faculty who perform a broad range of research in hearing, balance, speech, language, taste, and smell areas. I also, let me switch back. What I'd like to do right now is have maybe Dr. Mark Rutherford, who's one of our current mentor faculty, and his trainee, Amit Walia, maybe give a little discussion about the mentored research experience. Amit, maybe you can talk about how you found Dr. Rutherford as your mentor, and maybe speak a little bit about your experience so far.
That sounds good. Amit, you want to go first, or should I go first?
I can speak. I can speak first. So my name's Amit. I just started my T32 research years. Can everyone hear me okay? Hello?
Yep.
Okay.
Yes.
Yeah.
So just
everyone else mute.
So I just started my T32 research year, and the process that I went to in terms of finding a mentor was I knew I wanted to do research related to otology, neurotology. So, and there were plenty of research faculty available here at WashU to discuss research projects with. So initially I met with Dr. Buckman, and he recommended a list of faculty to meet with and just hear about their research. So I had almost 15 to 20 hours of conversations with all the researchers, all the faculty that was available. And then with the faculty members that I connected with well, that I enjoyed their projects, and the faculty that I thought would be most successful with, I re-engaged with those ones. And I decided to join Mark Rutherford's lab. One of the main reasons being that I thought my previous research experiences would be well applicable to some of the research that Mark was doing. And it's been about 3 months since I've started the research experience, and I've thoroughly enjoyed it, and really appreciated Mark's availability and the progress that we've made on our project. I'll let Mark speak a little bit more about this.
Yeah,
yeah.
thanks. Yeah, I feel the same. So I'm Mark Rutherford, assistant professor of otolaryngology, and as Jay mentioned and Amit said, we study cochlear physiology, specifically glutamate transmission and excitotoxicity. And we have NIH funding and foundation funding to do this. And now we're writing proposals to the Department of Defense, and we're forming a small business concern to develop one project into an asset, hopefully. And this is the project that Amit is taking part in primarily. And having him as a T32 postdoc for 2 years is really what's going to make this startup project a success in the near term. And I like this mentoring relationship that the T32 offers for several reasons. For one thing, it's a two-way street, and we learn a lot from each other, mutually beneficial. And so also it's very much about the here and now. We work together almost every day, and we discuss progress and set goals for tomorrow's experiments. But even more importantly than the success of tomorrow's experiments is about learning a way to approach scientific problems and how to produce scientific advances in the lab in general. And moreover, it's about establishing a long-term relationship. So right now we're screening novel compounds for efficacy and then safety, and hopefully 5 years from now we'll have a phase 1 clinical trial, and I hope that when I see Amit 10 years from now we'll have the first drug in use in humans for prevention of noise-induced hearing loss.
Mark, thank you. Thank you. I'd like to ask Neil Bott, can you talk a little bit about your relationship with your mentor, Neil, and also talk about where you are right now? Neil's one of our alum.
Sure, happy to. So I finished the T32 years, I think 2015, 2016. I worked with Dr. Randall Paniello, and my research was pretty much translational animal models, better understanding motor and sensory changes in the larynx, various neuropathies. I followed Andrea Park, who's also on this call, and so I really benefited from her being in the lab. So a lot of the projects that were ongoing, I could continue those. But the 2 years were fantastic, really offering me the opportunity to fail, succeed, really grow and think about the projects. And I finished fellowship last year, and now am starting in a clinician scientist position at University of Washington. So 50% research time to really keep growing, keep learning, and with the ultimate goal to being an independently funded physician scientist.
Excellent, Neil. Thank you. Helena, do you want to describe a little bit about your experience? You know, how you selected mentor and what worked well for you?
Yeah. So I'm now a PGY4, so I did my research here a year ago. I finished it in 2 years ago. I worked with Dr. Piccirillo in the clinical outcomes research office. I'm interested in rhinology, so for me, Dr. Piccirillo had a couple of smell projects going on at the time, and I thought that would be a good fit for me. Also, Dr. Piccirillo, I don't know if the applicants know, but he developed SNOT-22, which is a validated patient-reported outcome measure that we use in rhinology a lot for patients with chronic rhinosinusitis. So for me, I really had done a lot of basic science research prior to residency, and I wanted to get more exposure to clinical research. And so I would say that the clinical outcomes office at WashU is a very unique aspect of this T32 training program. You have access to Dr. Caligiuri, she's a biostatistician, and also Sarah Kuklajan, who handles a lot of the IRB process. And it's a very unique infrastructure that it's difficult to find elsewhere. So I learned a lot from being in the office, having the opportunity to have guided mentorship, and then also participating in the MSCI program.
Great, Polina, thank you. Any of the other alum or current trainees want to speak about the mentored relationship, how they picked a mentor, the meetings? How about, it's a little bit like Polina, actually she stepped back into clinical, or Neil, maybe some of our alum. How do you keep in touch with your mentors, and what type of relationship? Hey, Andre.
Hey, how are you?
Good, good.
Hey, Judy. Hey, Craig. Sorry, I'm missing y'all at our National Academy. This virtual is kind of
Yeah.
an adjustment. I was just
Good to see
thinking,
you,
I was
Andre.
texting Lauren on the side. Hey, Judy. I started 12 years ago residency, and it's just kind of flown by. It's crazy to think that. So I came from Arkansas, medical school from Arkansas, matched at WashU, did a T32, and then did my PEDS fellowship at Cincinnati, and now I'm back at Arkansas Children's. And when I was looking at programs, I only looked at a couple T32 programs because I knew I wanted to do clinical research, clinical outcomes research, because in med school and undergrad, I did a lot of bench research and basic science research, and I knew that wasn't for me. So I knew of Dr. Piccirillo from a faculty at Arkansas. So when I matched at WashU, I immediately kind of sought out Dr. Piccirillo, and we talked about various projects. And he was working on tinnitus and imaging of tinnitus on patients that were bothered by tinnitus. And I remember sitting across from him, and I said, well, what did the non-bothered tinnitus, what do their brains look like? And he sat back and was like, well, I don't know. We never looked at it. And then that was, I think, my intern year. And then the next year we wrote a core grant and submitted it to look at essentially non-bothersome tinnitus and functional connectivity in that patient population. And the core research grant that I applied for was denied, but since it was such a good project, it actually got reallocated, and it was awarded a essentially assistant professor level grant, the Percy Memorial Grant. And that money funded essentially 2 years worth of research, paid for a psychiatrist, helped pay for a statistician, helped pay for a collaborator in neuroimaging, paid for the scans, paid for patient reimbursement. So I was the PI on a grant as of essentially finishing my PGY 2 year, learning how to not only write a grant, but actually carry it out. And then while I was in the lab, so to speak, I wrote another grant that was funded for my 10 weeks of research as a PGY 3. So I was awarded 2 core grants during residency, and a loan repayment grant as well. So, you know, identifying a good mentor at WashU is pretty easy because everyone's fantastic and everyone's so approachable, and essentially we're free labor. So, and we work hard. So everyone really wants us in their lab. But there's great rewards to it as well. And I'll make a plug about the MSCI as well. The MSCI is a Master's of Science through Washington University Graduate School. And I knew about this program, and I mentioned to Jay, would it be possible if I could go through this program during lab time? And he talked to Rick Cole and a few others, and not only was it approved, they paid for it. So not only did I, you know, get a master's from WashU for free, I also learned kind of the coursework to continue to be successful after residency and fellowship. So I've gotten a couple grants here and there. I'm super busy clinical, so it's now a new balance of figuring out how to save time to make time to do these research projects. And unfortunately, not every place is like WashU, where you have such strong collaborations and strong research interest, but that's a different struggle. But sorry, I didn't mean to ramble on.
Yeah, that's right. Thank you, Andrea. Anybody else want to make maybe one more comment, and then we'll move on to coursework, since Andrea said. Maybe Carla?
Yeah, so I'm like Paulina, currently in 4, and we did our T32 between 2017 to 2019. So I started early looking for a mentor. I started in my intern year, and I remember talking to Dr. Buckman about his previous research in cochlear implantation, and I ended up doing a basic science and clinical project during my T32 time. Dr. Buckman introduced me to Jeff Lichtenhahn, who does a lot of work with electrophysiology. So with him, I did all my basic science research where we recreated a model of endolymphatic high drops, and then that led to a core grant application and the award, which I worked with Dr. Mark Rutherford, looking at synapses and endolymphatic high drops. And so just to echo what everyone else has said, I think there's so many opportunities here at WashU, not only in basic science, but also clinical. And I think it's really neat that you just have so many people that you can work with, and these projects evolve. And I think that's the really exciting, one of the really exciting aspects of being a T32 in this program. There's a lot of support, like Paulina mentioned. It's just fantastic. The opportunities are endless. So.
Great, Carla. How about Andrea? Now, Andrea, can you kind of help us transition over to the coursework part? And as I recall, I don't think you got the master's. Did you take some specific courses that helped to round out your research experience, or talk a little bit about that?
Oh, so actually, Dr. Piccirillo, I was just going to kind of add a comment initially about the mentorship process. So when I was first starting, I got to look through the list and talk to you and met with you and kind of talked about my goals, which was really great. And my goals and kind of coming in, sort of like Andrea, I was really interested in the T32 programs in particular. And there really weren't a ton of programs that really gave you dedicated time and really a great infrastructure to be able to make that time useful. 2 years, even though you think it's a lot of time, doesn't necessarily really equate to a lot of time, especially when you're doing basic science research. So I had some research experience in the past, and I was in particular interested in getting a little bit more animal research, larger animal research experience, as well as figuring out a way how, to translate that going forward. So I, as Neil had mentioned, had done research with Dr. Piccirillo, and we started a myriad of projects kind of spanning, and if you looked at that sheet, he does kind of basic science, clinical research, and translational research. So I really got to kind of spread my wings and, learn about the different aspects. In terms of the MSCI, I actually did not end up taking classes for that year, but I know that several of the other T32s have.
I can talk about
Great,
the MSCI more.
Sure, thank you, Andrea. Andrea, how about you, Lauren? Yeah.
Hi, I'm Lauren. I work at UCSF actually with Andrea. I'm, graduated residency in 2018 and then did rhinology fellowship. And I've worked 1 year at UCSF. And so I did the MSCI 2013, 2015. And I think it was one of the most, I think it's very helpful in terms of showing for your future, showing that you're interested in being a serious physician scientist, because I think a lot of people later on realize that they sort of need that educational foundation in order to continue once they're sort of on their own. So I think it's been really helpful to me, for me, in terms of thinking about people's research, thinking about my own research, critiquing other people's research, and also just showing when I was applying to fellowship and to jobs that I was serious about having a physician scientist career. So the classes that I remember taking that were really helpful, there's a scientific writing class, a grants writing class, just basic study design is really helpful, things you don't think about, but are actually very nuanced. And then I took a systematic review meta-analysis class where we actually went over the the statistics of a meta-analysis, and that has been useful. I think several people have taken that class, and we've published a lot of systematic reviews from our department.
Excellent. Maybe we take a stop for a second and see if there's some questions from our medical students. Carla, is there anything on the chat box?
I don't see anything in the chat box so far.
So I actually had a question myself. This is Wasinan speaking. So I was curious as to research opportunities like within the residency, but outside the funded years. I know 2 years is not a lot of time, especially for basic science. Is there research time built in, and for the residents that have gone through the T32 years, was there a time later on, in your PGY 3, 4, 5 years to get involved?
Yeah, Dr. Liu, do you want to answer that in some way?
Yeah, sure. So the PGY 3-year has time for the T32 residents to come back and to do more research. It's actually mandated by the ACGME. So every program in the country should have 3 months of research for every clinical resident. And so we have included more time during the PGY 3-year after you leave your T32 years. Does that answer your question?
Yeah, definitely. Thanks.
I see a question here about device development, and it gives me an opportunity to talk about tech transfer, entrepreneurship, and device development in specific. So we do have a really great relationship with the, it's called the Cortex Center here at WashU. I've got a picture next where here we go. The trainees can take courses, participate in entrepreneurship, research, innovation, tech transfer of their own products, or serve on review boards of venture capitalists and business people thinking about investing in WashU intellectual property. So it's a great opportunity for both developing your own devices, but also trying to look at the commercialization side. We would like to partner with biomedical engineering all the time. We have not had many trainees who have partnered, but it's just sort of the way it's happened. Washington University has a very strong biomedical engineering college, and lots of people that do really cool stuff on the other campus. And that would absolutely be something that we'd love to have our T32 trainees do more of, that is collaborate with biomedical engineering. Great. Unless there are any other questions from the trainees, maybe we can talk a little bit more about career development. Let's see, who maybe Lauren, Andre Wineland, Andrea Park, Neil, maybe some of the things that you did during the 2 years that helped with career development. Lauren, I know you spoke a little bit about it.
Yeah, I can speak about that. So one thing that's come up for me recently is I spent time reviewing papers with Dr. Piccirillo, who I should say Dr. Piccirillo was my mentor, my main mentor. And we spent time reviewing papers together. Now I was just recently asked to be on the editorial board of one of our ENT journals. And I'm 1 year out of fellowship, so that was exciting. And I think I've reviewed many articles on my own now. And then, let's see, part of our program is once a month we meet as a group of all the T32 residents and all the T32 faculty and go over sort of things like grant writing, reviewing each other's grants, talking about career development strategies and negotiating and things like that. And that has all become, I didn't really realize how relevant it was going to be, but it's all become very relevant for me now.
Excellent. Neil, do you want to speak a little bit about how maybe you negotiated your faculty position, and in what ways the training here, both the 2 years that you're in the training program and then the 3 years afterwards, your years 3, 4, and 5, maybe how that helped to get you ready?
Yeah, I think that the 2 years gave me a lot of time, opportunity to really think about what kind of career I wanted. And I think with the years 3, 4, and 5 after the T32 years, I would say in a lot of ways we're even more productive because the first 2 years were really setting the foundation, and then it really gives you the opportunity to grow and still do the things clinically and research that you would be doing ultimately in your career. And then during the end of residency and fellowship, I had narrowed the search for looking at places that might be interested in hiring someone with clinician scientists. And I don't have a PhD, but I have the T32 years as where I was coming from. And I think I was just very impressed with the support I got from WashU, from mentors, obviously Dr. Piccirillo, who I worked with a lot, but everybody in the T32 program giving advice, ideas on how to develop your budget, things to ask for, and how to really negotiate in a way that's going to set you up. And I feel very confident that I have every opportunity that I would want right now to really make it to the next level. So I feel like I'm in a great position. I couldn't ask to be in a better position.
Thank you, Neil. Andrea Park, do you want to talk a little bit about how you transition out of the 2 years of research into years 3, 4, 5, and then ultimately into your faculty position?
Sure. After the first 2 years, kind of getting all these projects started, luckily I had Neil kind of coming after me to help kind of continue with a lot of those projects. So we're able to, see to the end, at least one of the Vocalog papers that I know was just recently submitted. We were looking to see, and this was actually a core grant that we had received. It was looking to see whether or not voice rest actually makes an impact on after benign vocal cord surgery. And, I would say for the next several years, it really gave me the opportunity to think about what I wanted to do. It definitely confirmed the fact that I want to continue with research. It really helped kind of frame how I started looking at things clinically, trying to think of additional questions and just being always inquisitive. I think from the main takeaways from that program, it was really fantastic. We're giving a lot of background about the program, but without having actually gone through it, you don't really realize just how fantastic of an opportunity it is. And, we have talked about the PTSD program and being able to do the MSCI. Even though I didn't take advantage of that, didn't take advantage of that MSCI program, I will say that I did get so much from the program itself. We reviewed articles together, also with your mentor, and we got a lot of feedback from our peers, and also faculty have been very successful with grant writing and with writing papers as well. And I think the other main thing that I did after my 2 years was that I started serving on the core grant committee, reviewing grants. And that's something that I've been able to continue even in facial plastics. I'm now actually a part of that research committee here. So it's been really great. It's definitely been a segue. And you get to see kind of the cutting edge, research is what's really interesting at the time, where can you improve going forward, and you can just kind of direct the research in your field, which I think is really amazing. And I think in terms of transitioning to my academic position, a lot of facial plastics research is a lot of kind of observational and / clinical research. So I'd really love to be able to kind of branch into the more basic science aspect of it. So certainly kind of, thinking of projects as we go along, and I've had the opportunity to really talk to many of my mentors about this. And I think a big thing to also remember is that, as you go along your training, you'll have several mentors. And the great thing is that you can really call up anyone at any time or email them or reach out to them. And everyone has been so incredibly supportive.
Andrea, thanks so much. You brought up the grants writing stuff that we did during the academic career development conference, scientific writing, some of those other aspects of the monthly conference that we have called Academic Career Development Conference to sort of round out the research experience. And that's open to all the residents, including, the T32 residents after they go back into clinical. What I'd like to do is show a map here of where some of our T32 alum are, including the ones that are on with us today, starting with Dr. Piccirillo, who went through the program in 1992, and he's still here at WashU. And we've got Dr. Ellis Arjamont, Surgeon Chief down in New Orleans at New Orleans Children's Hospital, and Norm Hickey up in Michigan, and Bob Young in New Jersey, Jim Katiccia in Detroit, and Sid Kosla, Cincinnati, Eric Jenden at Mount Sinai in New York, Judy Liu, of course, here in St. Louis. We also have Ravi Upalari in Boston. There, can you guys see? Good. Joe Padafar up in Dartmouth. We've got Urj Patel in Chicago, Johnson Wu at Stanford, and then we've got Ken Lee at UT Southwest Dallas, and Ren Yang at UC Estee, Mega Young at Yale, and Mike Brenner at Michigan, Davud Sarjani at Stanford, and then Eric Wong at Pittsburgh. We've got Jason Rich, who's on our faculty here, and then Fumi Ukiyama, who's at UNLV. She was hoping to be with us tonight, but couldn't make it. And then Andre Weinland, who is with us today, and then Andre Park at UCSF, and Kathy Cow down in Houston, Lauren Rowland at UCSF, and then finally our most recent one, Neil Bott, who's now up in Seattle. So, here's a good picture of just some of the trainees in the program. What I thought I might do in the last couple of minutes is, open it up obviously to questions, or maybe just words of advice from our current T32s. Obviously, they're most close to the medical students, and maybe hearing a little bit from them about words of wisdom or things of advice for the medical students who are with us today would be a great way to end out the night. Who wants to? Tom, you want to get a start? Tom Barrett, I know you didn't get a chance to speak yet.
Sure. Thanks, Dr. Piccirillo. I think in terms of words of advice, for me, coming into medical school, I took kind of a non-traditional route. I was actually a liberal arts major undergrad, did a post-bac program. So in med school, when I entered, I thought I'd be purely clinical, but I found that I really enjoyed research throughout med school. And then, I didn't know that these T32 programs were a thing until I started sub-Is and whatnot. And then the more I learned about them, the more I realized this is a fantastic opportunity for someone like me who came from this background with, minimal science beyond whatever pre-med requirements I did to actually, grow as a researcher and possibly, develop a career for myself, which I'm a physician scientist. And I think it's totally possible in this program. And I think it's totally possible to come from that background and make that reality for yourself too. So just in case there's a med student out there who's, wondering if this is for them or not, I would say, don't be shy.
Great, Tom. Thank you. Other words of advice from some of our current T32s or recent finished Ts? Paulina? Carla?
So this is a great program. I mean, I think one of the things that stood out for me on my interview day was just being blown away by how big Barnes Jewish Hospital is, seeing the caliber of the surgical training here, which is fantastic, but also the rich history of the T32 program, knowing that it's been so successful with their trainees really impressed me. And then going through the program, I remember, being an intern and hearing people like Lauren or Pete, critically appraising articles and thinking, oh man, I wish I could do that one day. And then going through the MSCI and understanding how to do that. And now, it's not as intimidating as it was when I was starting out. This is just a great place. There's so many opportunities to grow as a surgeon and as a scientist. So you can't go wrong.
Paulina, any words of advice what the medical school students should think about?
I would say that, this is truly unique opportunity with the T32 at Washington University, because I had looked at other T32 programs, and this is a place where you not only have the option for basic science, but also clinical research. And I think I've had such a really positive experience from my 2 years, applying for core grants, taking the master's course, and getting really good mentored research. And I think the faculty support here is unparalleled. It'd be hard pressed to find something that we have here elsewhere. So I'd highly encourage you to think strongly about this program. I've had nothing but great experiences so far.
I didn't mention, but Paulina and Carla and everyone, I think, has really benefited from the research infrastructure that we've been able to create. Dr. Buckman's vision and help, and Dr. Liu and all the faculty have helped to support the research biostatistician who's part of our department, who's available to all of our medical students, our residents, our T32s, of course. And then we have a research compliance coordinator, a full-time staff person who helps with all of our IRB submissions, renewals, and any kind of issues that come up with human-based research. And it's just a great infrastructure to take advantage of. Questions again from the med students, anything about the program? I think Tom hit it nicely when he talked about how he didn't have a PhD background. He didn't have a strong science background. He was the humanities, in fact. And so you don't need to have a PhD applying to our program. We really look for people who, like Tom said, want to incorporate research into their career, really have a desire to ask and answer important questions, and hope through this program to get the tools and techniques, the skills set needed to answer those questions.
I think also just to mention something about the core grants. Those grants are really hard to get, and I think one thing that was really impressive is that it seems like every year there's always a WashU person getting a core grant. Paulina got 2 core grants. I got a core grant. Andrea and Lauren got core grants, and so there's just such a strong track record of success, which is really helpful when you're applying for grants as well.
Mm-hmm. Great, Carla. Again, our guests, questions about the program?
Hey, Jay, in case you didn't see it, Fumi has made it onto the Zoom.
Oh, wonderful. Welcome, Fumi. Introduce yourself briefly. Hey, introduce yourself briefly. Maybe just speak a little bit about what the program meant to you and how it helped you get into your faculty position now in 2 minutes.
Sure. Hi, everyone. Fumi Okiyami. I finished in 2015, did my fellowship at Iowa afterwards in head and neck cancer and reconstruction. So I was T32 for about 2 years with Dr. Piccirillo. And Andre, I see you're on here too. Good to see you. Andre and I were co-residents during the T32 years with Dr. Piccirillo. We were both interested in clinical research, and I think that's what we've mainly focused on. For me, it allowed me to be able to really appreciate more research in terms of like how it impacts the patient care. And really, when you go into clinical practice, how much it truly affects how you take care of your patients, as long as you really make that effort to make sure you're treating them with evidence-based ways. So the other thing too is, I didn't get, I applied, I got the experience writing a lot of grants with Dr. Piccirillo. We wrote for some RO3s, even though we didn't get those at the time. But, when I finished, that experience actually allowed me to be able to even competitively write for a BGH grant. And we got funding for over $55,000 on a quality control project. So I think no knowledge is ever wasted. And the time that you do spend in T32 years, it really makes you, it increases your toolbox in terms of being a clinician and also being a clinician scientist. And there's no, you don't have to go into, if you decide you don't want to do research later, that's fine as a focus, but it at least opens your mind up to it. And it really, really makes a difference in terms of your career when you go to somewhere else. Because now you can actually do research, you can start research, and you can successfully mentor med students and residents to actually perform good research as well.
Fumi, thanks so much. That was great. And again, thanks for joining us. Looks like you just got out of the OR or in between cases or something.
In between.
Yeah. In between cases. Okay. again, happy to take any specific questions. We have obviously a website with all the information that you would need to think about. I would be happy to take specific questions if you wanted to email them to me. Judy, did you have any closing remarks about the application process that you wanted to share with the attendees?
No, I just want to make sure that other than saying that, you know, we don't do any cutoff screening in our program. We read every single application. But I do encourage you to sign up for the preference signaling program. I can't see any downside for the students. And it helps the programs to know if you were interested in us. So I encourage you to look at it, to work with your faculty mentors and program directors to how best utilize that new program. And I look forward to reading your applications.
Great. Well, listen, this is a great opportunity for us to describe the T32 program. It's a great opportunity for a lot of our alums to get together. We didn't have the Academy meeting this year, so we missed that opportunity. So great to see new faces, and great to see familiar faces too. We wish all of you the best of luck. We understand what an important decision this is to make, such an important decision during this very challenging time of COVID. So, you know, our hearts go out to you. We wish you the best. We're here to answer questions, and perhaps some of you will see virtually later this year. Thanks so much. Okay. Good night.
Thank you. Good night, everyone.
Bye.
Bye-bye.
Bye. Bye. Bye, Lauren.
Bye.
Bye for me.
Good to see everyone.
How are you guys doing?
Everyone's